Hey there. Today we are talking about yet another study that was released just last week from the American Cancer Society. It highlights how nearly half of cancer cases and deaths in the U.S. could be prevented through lifestyle changes. It's a good news, bad news kind of thing. Good, because we can totally do something about our risk factors. Bad, because it takes work on our part. And let's be honest, we don't always want or know how to do that. This study confirms so much of what I have said before about our lifestyle's impact on health. The study was conducted in 2019, and it aimed to estimate the number of cancer cases and deaths that could be attributed to modifiable risk factors in adults 30 years and older in the U.S. The risk factors include smoking, excess body weight, alcohol consumption, dietary habits, physical inactivity, and infections like HPV and hepatitis B and C. Welcome to the channel. If we haven't met, I am Rachel, and I really appreciate your being here. Now, before I get started, I want to take just a minute to talk about Shannen Doherty, who passed away last week from complications of breast cancer. She was only 53 years old. We were not that far apart in age. When I was first diagnosed, her story was one that I followed because she was incredibly motivating to me. Her death actually hit a little hard. As a cancer survivor, anytime you hear of someone passing from the type of cancer you've had or close to you in age, it sparks not only sympathy and empathy, but also a little bit of fear. I've talked about this before. I don't care what stage you are or were. It brings it back to the forefront, and it makes you a little sick to your stomach. But I have to remind myself, all our journeys are different. Even with the same diagnosis, they all take a different path. And I hope that anyone who is watching this and feels that same twinge remembers that. That is why I emphasize these lifestyle changes. I have had that diagnosis. I know that fear, and I do not wish it on anyone. In the U.S., 1 in 2 women and 1 in 3 men will develop cancer in their lifetime, and approximately 1 in 12 women and 1 in 9 men will die from it. If almost 50% of those can be prevented by lifestyle choices, what are we waiting for? Being diagnosed with cancer at any stage is life-changing. You start to question everything, your lifestyle, your choices, and your future. I am here to encourage you to pay attention to these things before you get a cancer diagnosis. Now, back to the study. Dr. Arif Kamal, the Chief Patient Officer with the American Cancer Society, emphasizes that while genetics and environmental factors do play a role in cancer, modifiable risk factors explain a much bigger share of cancer cases and deaths. This is a good thing. It means we have more control over our health than we think. Dr. Kamal noted in an interview that I saw that cancer diagnoses in people aged 30 to 50 continue to rise, most likely due to lifestyle or environmental exposure or a combination of the two. Our DNA is constantly being bombarded, so if you can change these things, why wouldn't you? Let's break down some of the key findings of the study. Approximately 40% of all cancer cases in adults in 2019 were attributable to modifiable risk factors. And this just highlights the huge impact of lifestyle choices on cancer development. Now, smoking was the leading risk factor, contributing to nearly 1 in 5 cancer cases and almost a third of cancer deaths. Being overweight, drinking too much alcohol, poor diet, and a lack of exercise are also big factors. Maintaining a healthy body weight, limiting alcohol, eating well, and being physically active can substantially reduce cancer cases and deaths in the U.S. Now, lung cancer stands out with the largest number of cases attributable to modifiable risk factors. Primarily smoking. Over 200,000 cases could be prevented each year by quitting smoking. Being overweight is also a huge concern. It is linked to more than a third of deaths from endometrial, gallbladder, esophageal, liver, and kidney cancers. This just underscores the importance of maintaining a healthy weight through diet and exercise. Regarding breast cancer, one of the most common cancers affecting women worldwide, excess body weight and alcohol consumption are modifiable risk factors associated with an increased risk of breast cancer. Maintaining a healthy weight through proper diet and exercise and cutting back on alcohol can help reduce this risk. This study emphasized the importance of consuming a diet rich in fruits, vegetables, as low consumption of these foods was linked to an increased risk of certain cancers, including breast cancer. Now, there are certain cancers where modifiable risk factors play an even bigger role. For instance, more than 90% of melanoma cases are linked to UV radiation, and nearly all cases of cervical cancer are linked to HPV infections, as well as anal, penile, throat, tonsil, and tongue cancers, which can all be prevented with a vaccine. So, what else can we do to reduce our cancer risk? Here are the recommendations from this study. They are going to sound familiar, but when they work, they work. First, quit smoking. It is the single most effective way to reduce your cancer risk. Next, maintain a healthy weight, focused on a balanced diet rich in fruits, vegetables, and whole grains, and limit your intake of ultra-processed foods and processed meats. If you drink, do it in moderation. Protect your skin from UV radiation. Use sunscreen, wear protective clothing, and avoid tanning beds. I wish I had known this in college. Get vaccinated. Ensure you are up to date on vaccinations for HPV and hepatitis B. The CDC recommends the HPV vaccine for children and adults, male and female, aged 9 to 26. People aged 27 to 45 can choose to get the vaccine, but the CDC notes that they've probably already been exposed to HPV, so talk to your doctor about it. The Hep B vaccine is especially recommended for people with chronic liver disease, hepatitis C infection, HIV, or diabetes. Now, it's usually given at birth, but it is safe and effective at any age. 90% of people who get that vaccine are protected for life. These findings have got significant implications on public health policies and interventions aimed at reducing the burden of cancer in the U.S. Just by promoting healthy lifestyle choices and implementing targeted prevention strategies, we can potentially prevent a substantial number of cancer cases and deaths. Now, I want to make it clear, I am not trying to food shame anyone or tell anyone that a cancer diagnosis or even obesity is their fault. But our food environment plays a huge role in our health. Food manufacturers and their lobbyists heavily influence our decision-making by providing an abundance of cheap, unhealthy, ultra-processed foods, and then telling us that everything is fine in moderation. Profits and paying shareholders are their priorities. They do not have our best interests or our health in mind. We have to be proactive and take care of ourselves. We can't always rely on our doctors or dietitians for guidance, especially since not everyone has access to them or can afford them. It's up to us to make informed choices about our health. This study underscores the importance of addressing modifiable risk factors to reduce the incidence and mortality of cancer in the U.S. By making informed choices, we can take proactive steps towards lowering our cancer risk. We can work towards a healthier future with fewer cancer cases and improved outcomes for everyone. Now, you might have seen the video I did about how only 4% of cancer survivors adhere to cancer prevention guidelines. I will link it here or here. I'm not sure which. This study from the American Cancer Society just reinforces the importance of those guidelines. It shows that many cancer cases and deaths are linked to lifestyle choices, emphasizing the need for cancer survivors to follow these prevention strategies just to improve their outcomes and reduce the risk of recurrence. Let me know your thoughts down below. Do you believe that what we're eating and our lifestyles play such a big role in all the cancer diagnoses we're seeing? If not, what do you think is? Thank you for watching. If you made it this far and you found this video helpful or even a little bit interesting, don't forget to like, share, subscribe, do all the things so you don't miss anything. I will see you the next time, and as always, take care of you. Thanks for watching. Bye-bye.